Hey everybody, we're back for another live course here with Corsetta Nursing. Today we're going to go over dosage calculation. So I noticed that this was kind of still a big topic, even though it's probably for most people a couple weeks in nursing school at least, but dosage calculation is pretty common. A lot of people get anxious about it just because of what's at stake with dosage calculation. So in this course, we're going to go over everything you need to know with dosage calculation. So we're going to go over all the formulas and then how to convert all the metrics and all that good stuff. So we're going to actually do some problems together too. And then this, of course, this live will serve as a Q&A. So if you guys have questions about how we got to that answer, then you guys can go ahead and just, ask me in the question box there, and we'll answer any questions that you have. So we're going to go ahead and get started. So dosage calculation, as you guys probably already know, a lot of the times you'll have to get like 100% on the dosage calculation exam to keep going in nursing school. So a lot at stake, but usually it's, once you get past it, there's usually not any, you kind of find out that it's not as bad as you thought it would be. But of course, anything you have to get 100% on is always nerve-wracking. So we're going to go ahead and keep going with this. So first things first, before we get into all the formulas and all that good stuff, dosage calculation has some rules that you'd want to follow. So what are those rules? So there's three main rules, and it really all has to do with the numbers and how you get to those numbers. So the three main rules is, first off, you need to know how to round. So if you don't know how to round, then of course it's going to make things a little difficult for you. But the biggest rule is that you never round until you reach your final answer. So if you have multi steps in with a problem you're trying to find, you definitely don't want to round a number before you actually get to your final answer. So the only number you actually should be rounding is your final answer, depending on what your instructors tell you how you should round. So a lot of the times they'll tell you before the exam, or the question itself will tell you round to the nearest whole number, for example. So right here you can see like numbers in thousands place 5 or greater, so you just need to know how to do your simple rounding. So 0.5 or greater, you round up, and then 0.4 or less, you round down. So here's the examples here. You got 58.92. Well, you round that up to 59 if it's asking for a whole number. And then another example too is if you have a number that's 58. What if that number is like 58.4? Well, you round down to 58. So you just need to know how to do the simple, basic, rounding. So nothing too crazy so far. Next is no trailing zeros. So every time you put an answer down, you should never have a trailing zero. So good is 0.6, and a bad number would be 0.60. That's a trailing zero, so you don't want to have any trailing zeros. All right, and then also zeros before your decimals are also bad. So you don't want them just hanging out anywhere random, and you also don't want them just, you just want to use them. The zeros are very important, obviously, in dosage calculation. Because if you don't actually put the zero in real life, that can easily get misinterpreted if you just put like a 0.6. So that's why in real life we require you put like 0.6, because it could be like 0.6 grams, which is 600 milligrams. So that's why they have that. So make sure you guys know these rules. So never round until you get your final answer. No trailing zeros, and zeros before your decimals. So that's what you do before you even start your dosage calculation exam. And then abbreviations. So there's lots of different abbreviations that you'll just kind of need to understand. A lot of the times they cover this kind of stuff in a medical terminology class. But half the time people don't really remember half of this stuff in medical terminology. But if you go over these one by one, you'll kind of, after so much repetition, you'll remember these, because there are just not so obvious ones. But Q means every, for obviously, and then H is hours. So there's those that are pretty decently easy. BID, so bi, daily, so twice daily. TID, so tri. QID, quad, so 4 times a day. So those kind of things that you'll need to know, because sometimes they'll put it in your question itself. And of course the route, you'll need to know all the different routes. You'll definitely need to know that in practice for sure. And then, knowing what milligrams is abbreviated as, micrograms, all that good stuff. So before I even continue going on, make sure you guys know that you can download this dosage calculation form for completely free. I'm going to go ahead and put it in there on the website that you can find it at. So we're going to go over this worksheet today and actually fill out the problems on it. So if you're having any issues, just please drop it in the comments there. And if you have anything you need to clarify while we go over this live course, don't hesitate to ask me a question. But the form I'm showing you right now is completely free on CourseDataNursing.com, so you can get it there. All right, so step one, every time you do a dosage calculation problem, the first step is just simply convert the metrics. So whatever answer they want you to get to, you want to convert what you have to that metric. So for example, if they have a medication that's available, so you have a medication on your unit that is in milligrams, and they want it dosed in grams, well, you need to convert that milligrams to grams. So it's pretty simple. Usually a lot of people kind of overcomplicate this because there are different ways to do it. But the simplest way really is to do the volume conversion by just simply moving the decimal points. So how you do that is if you're going from a larger to smaller number, you move the decimal 3 points to the right. So for example, if you're converting 4 grams to milligrams, you would convert that by moving the decimal point 3 points to the right. So as you see in this example, we have 4 grams, right? And then we move it over 3 points, and now it turns into 4,000 milligrams. So that was how you would go from a larger to smaller number. Now, what if it was from a smaller to larger? So I want you guys to remember, if you want to get to a larger number, you need to go left. So both start with L, so large equals left. So you move the decimal point 3 points to the left. So if you have, say, for example, 4,000 milligrams and they are dosing it in grams, then you would move the decimal point 3 points to the left, and it would be 4 grams as your conversion. So you need to do volume conversion. So like sometimes, of course, they'll do mLs to liters. Of course, what you see here, milligrams to grams or micrograms to milligrams. So all that good stuff. So you just need to know how to do volume conversion for lots and lots of different questions on the dosage calculation. And then weight conversion. So one thing that my instructors always said, and it always stuck with me, is that you could say, I like my weight in kilograms. Why? Because kilograms looks like a smaller number. So that's just how you remember that 1 kilogram equals 2.2 pounds. So it's pretty much twice the amount. So you just need to remember that kilograms is the smaller number. So this is how you convert it. So if you're going from kilograms to pounds, you would just multiply that because 1 kilogram equals 2.2 pounds. So if you have 52 kilograms, for example, you just multiply it by 2.2 and you got your answer in pounds there. And then vice versa with the pounds to kilograms. Say if you're 160 pounds, you would divide it by 2.2 because if you're trying to get to a smaller number, such as a kg, you would divide it out and it would get to 72.73 kgs. So this is always the first step with dosage calculation. Because if what you have is not matching up with what they want dosed, then you always want to convert first before you even start putting numbers into a formula, of course. So that's always the first step. So once again, guys, if you're just joining in, this form is completely free on CourseDataNursing.com. I dropped it in the comments there that you can download for free right now if you want to. And you can follow along if you want. So I'll be here for a while. We just started. We'll be going over various different problems and every single formula that you'll need to know for your dosage calc exam. So we're going to go ahead and go to step number 2. So there's 2 steps for every dosage calc problem. Is number 1, convert the metrics, and then number 2, just use the dosage formula pertinent to the question. So what you're going to see the most on your medication dosage exam is going to be just the simple medication dosage formula. So you see here there's a bunch of random letters, so D, H, Q, and A. What does that even mean? Well, D, there's every problem you're going to have a desired dose. So desired, so what does the provider want? So whatever they prescribe, that is your desired dose. So that's what you're going to actually give to the patient. H is what we have. So H starts with, or have starts with H. So what do you have? So that's the dose that you actually have available in your unit. So if you went to go to the medication dispensary machine, that is what you would be able to pull out. So you'd always, of course, want to compare what they actually want as the desired dose. So what are you going to give them versus what do you have? All right, so it's always D over H times Q. So Q stands for quantity of the available dose. So what is the actual quantity? Say, for example, you have 300 milligram tablet. So your quantity would be just one tablet because it's 300 milligrams per one tablet. So it's either going to be tablets, milligrams, or milliliters. Just depends on your actual concentration if there is one. Hey guys, it's Will Kirkpatrick, nursing educator in Psych Corsetta. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. And then A, of course, equals answer. So let's go ahead and use some practice problems here. So a healthcare provider's prescription reads morphine sulfate 4 milligrams. The medication ampule reads morphine sulfate 2 milligrams by 1 ml. The nurse prepares how many milliliters to administer the correct dose. All right, guys, so what is the desired dose? So we use this formula every time we just want to plug in the numbers. So we have to learn how to identify what numbers are pertinent to the question. So the first step is always like, okay, what does the physician want? Ask yourself every time, what does the physician want? I want to find out what they want. Well, you want to find the desired dose. So what's the prescription? So healthcare provider's prescription literally says it, reads morphine sulfate 4 milligrams. So there's your desired dose. They want you to give them 4 milligrams. Okay, so you put 4 milligrams here as the desired dose, as you see. And then the medication ampule reads morphine sulfate. So what do you have? That's the next question. So what does he want? And then or he or she wants, and what do I have? Okay, so what we have is 10 milligrams per 1 ml. So there's your answer with that. So you would substitute the H with a 10, substitute the Q with a 1, because it's 10 milligrams per 1 ml. Okay, so there you set up your problem perfectly there. So what you would do is you would divide 4 divided by 10, and you would get 0.4 times 1 equals 0.4 mLs. So if you guys are watching and you have any questions, please drop it in the comments. And if you have, if you need to clarify anything, I'll help you out. But we're going to keep on going with the next practice question here. So a healthcare provider's prescription reads phenytoin 0.4 grams orally twice daily. Okay, the medication label states that each capsule is 100 milligrams. The nurse prepares how many capsules to administer one dose. So of course, step number 1 is what? Always to convert your milligram, or always convert your metrics. In this case, what does the physician want? That's always the first question. What do they want? Well, they want 0.4 grams given to the patient. Okay, so now your next question is, okay, what do I have? So what do you have is that you have a capsule that is 100 milligrams. So you would first want to, so you have something that's in milligrams and they want something in grams. So what do? Step number 1, convert to milligrams. All right, so convert 0.4 grams to milligrams. So what you would get, if you guys remember, we're going from a larger number to a smaller number. So we're going to the right 3 decimal points. So we go 1, 2, 3, and that is equaling 400 milligrams is equal to 0.4 grams. Okay, so now we have what we have and what we want equal in metrics. So we go ahead and substitute it down with the formula. So again, the formula for medication dosage is D over H times Q. So what's the desired dose? We just converted it. It's 400 milligrams. What do we have? It is 100 milligrams. Okay, so we go 400 divided by 100 now. And then what's the quantity of the available dose? Well, it's 100 milligrams per 1 capsule. So you would just put 1 here again. So 400 divided by 100 times 1 equals 4 capsules. All right. So once again, guys, just stop me if you have any questions. We're going to keep going. So what we just went over was the medication dosage formula. And this is pretty much the largest quantity of questions that you'll get. And then, of course, what we're about to get into, IV infusion calculation formulas. So there's 3 different ones that they'll test you on the Dosage Calc exam. And once again, if you're just now joining in, make sure you guys go ahead and download this worksheet for free, where you can actually use these questions and go ahead and test your knowledge out on what we're going over. All right, so IV infusion calculation formulas, there's 3 of them. Now, these are actually pretty easy for the most part. They really are all actually easy once you just my really big recommendation is just do a bunch of repetition until it's like second nature. You don't really have to think about it. It's just, it's second nature at that point. You just want to do lots and lots of practice questions with these formulas. So that way you don't really have to worry about it on your exam. It's just like you're a machine by the time you do it. So you're going to see these quite a bit too. So you want to calculate mLs per hour. So mLs per hour. So the formula would be, it's really not complicated. Try not to overcomplicate it. It's the total volume in mLs that you have divided by the number of hours. Of course, it literally just tells you that's mLs per hour. If the time was given in minutes, for example, the total volume in mLs divided by the number of minutes, so whatever minutes they give you, and then of course how many minutes are in an hour times 60. So that would equal your mLs per hour there. So let's go ahead and do a practice problem and not move on to these yet. We'll come back up. So let's do a practice problem with mLs per hour. And if you guys feel like answering them, I mean, I know the answers are on here, but if you do want to download that worksheet, it'll be helpful for you to test your knowledge. But a healthcare provider prescribes 3,000 mLs of D5W to be administered over a 24-hour period. The nurse determines that how many mLs per hour will be administered to the client. So this is your typical mLs per hour question that you'll get on your dosage calc exam. So you use that formula, so total volume in mLs. So what is that? The healthcare provider prescribes 3,000 mLs. That's the total volume in mLs. All right, so we would put 3,000. All right, how many hours do they want it administered over? Well, they want it to be administered over a 24-hour period. So number of hours, 24 hours. And it's just that simple. You just divide those, and you would get 125 mLs per hour. So that's the very common question that you'll get on your dosage calc exam. And there's really so many ways you can word this question. It's if you know the formula, you're going to identify those numbers you need very quickly. So this one's definitely easier than like your dosage volume formula, such as the one we just did. All right, so let's go over infusion time. So also a very simple, straightforward one. So you would just divide total volume to infuse once again, divided by the infusion rate. So this time it'll give you a rate in the question versus just the mLs and number of hours. So it actually will give you the mLs per hour already. And usually they'll ask, of course, how much time would it take? So how much time would you expect it to take with this mLs per hour? So let's do the question. A healthcare provider prescribes 1,000 mLs of D5W to infuse at a rate of 125 mLs per hour. So if some question gives you a rate like that, then you know they're probably about to ask, how much time is it going to take? The nurse determines that it will take how many hours for 1 liter to infuse. All right, so how much volume do we want to infuse? Well, here it is, 1,000 mLs. So we'd put it there. Okay, what's the rate currently? It's 125 mLs per hour. So we simply just divide those out, and then there you go, 8 hours. So that would be how you figure out infusion time. All right, next this is one that a lot of nursing students kind of struggle with at first because it's so unnatural, and this is definitely not something, I'm going to be honest, this is definitely not something you're going to do in nursing and real nursing practice today. But they want you to do this because just in case, like maybe the EMR completely fails, and if all else fails, that we are skilled enough to be able to run our own drip basically, without having pumps and all that good stuff. So drops per minute. So GTT equals drops. So that's what that means. So good thing about this though is that if you see a question that even mentions drop factor, then you know that you use this formula every single time. All right, so if it mentions drop factor, all right, it's asking for drops per minute. All right, so here's your formula. So the total volume in mLs divided by the number of minutes they give you times the drop factor. Once again, if you see drop factor in your question, it's asking for you to use this formula. All right, so let's go ahead and use a problem because that's the best way to kind of see it in action. Gentamicin sulfate, 80 milligrams in 100 mLs, normal saline, is to be administered over 30 minutes. The drop factor, there it is 10 drops per 1 ml. The nurse sets the flow rate at how many drops per minute? All right, so if we know the formula is total volume in mLs over the number of minutes times the drop factor. All right, where's the total volume in mLs? The total volume in mLs is, where is it? Gentamicin 80 milligrams in 100 mLs. All right, so we'd put 100 there. Is to be administered by how many number of minutes? 30 minutes. All right, so we put 30 there. The drop factor is 10 drops per 1 ml. All right, so you got 10. So there's your formula, 100 divided by 30 times 10. You would get 33.33 drops per minute, And once again, you always want to round to a whole number with mLs per hour. So if it's asking a question about mLs per hour, or if it's drops per minute, they're going to ask for you to round to the whole number because it really wouldn't make any sense that you do a 33.33 drops per minute. So make sure you guys know, of course, how to do your simple rounding. So 0.5 or greater, you round up. 0.4 or lower, you round down. So this is 0.4 or lower because it's 33. So it is 33 drops per minute. All right. So that is your IV infusion calculation examples. So once again, you're going to see lots and lots of these. So mLs per hour is pretty straightforward, cut and dry. You're going to get your volume in mLs. You're going to get your number of hours. You just divide them. You get your mLs per hour. Infusion time too is also pretty cut and dry. The total volume to infuse. You divide it by, if it gives you an mLs per hour, they're most likely going to ask you how many hours it would take. So then you would just divide those two again, and you get 8 hours. And then drop factor is definitely the most difficult one because it kind of makes people, especially, nursing students and, new nurses even, is they're like, what the heck is drops per minute? How the heck do I even start with that? So if it mentions a drop factor at all, you guys just need to remember this formula and you'll be fine. It's pretty simple math too. But it really does stump people usually if they see like, what the heck is a drop factor? So that's why it kind of confuses people, I feel like. All right, so this is probably the most difficult version of dosage calculation is unit dosage per hour calculations. So there's 2 steps to it. So this is like your multi-step problem. So if they give you, a lot of times they'll give you like, heparin is a big example for these kind of problems. So because it's in units per hour usually. So step number 1 is just getting your units per ml. So sometimes it really just depends on the problem, but if it's heparin, usually it's already going to be in units, so you wouldn't have to convert, you wouldn't have to do step 1 with conversion. But let's go ahead and go over these formulas. Step 1, get units per ml. That's always your first step if they give you a units per hour medication, such as the heparin. So total amount of units in the solution is first, divided by the total volume of that solution. So really all you're trying to do is get the concentrated per ml. Don't think of it any more different than that. It's really you're just trying to get like the smallest number you can get with that. So you want to get the units per 1 ml. All right, then after you get that, the reason why you want to get units per ml first is because the step number 2, the formula requires a unit per ml concentration. All right, so step number 2, you want to calculate mLs per hour. So dose per hour desired. So what does the doctor want? Well, you would put that in there, divided by the units per ml that you just found with the step number 1. And then that's where you would get mLs per hour. So let's go ahead and use a practice problem. So if you guys have any questions or if something doesn't make sense to you, please go ahead and drop it in the comments and I'll do my best to explain it for you. So a healthcare provider prescribes heparin sodium 1,200 units per hour by intravenous infusion. The nurse has heparin sodium 20,000 units per 250 mLs. What rate in mLs per hour should the nurse set the infusion pump to deliver 1,200 units per hour? Wow, lots of numbers, kind of confusing right away, right? So if you guys do lots and lots of repetition, you'll be much better off because if you remember the formulas, really all you're trying to do with these questions is just try to find your numbers and just plug it in. Don't pay attention to all the other nonsense. If you know your formulas really well, there's way less likely you're going to get confused with the problem because right here, there's lots of numbers. There's trying to put in a scenario around it and it's just kind of confusing, but really just focus on the numbers, especially a dosage calc exam, because of course that's all they care about is if you can calculate the question correctly. So, all right, so step number 1, let's remember that formula. We want to get units per ml. So what do we need to get the units per ml? Well, first of all, we need to know the total amount of units in the solution that's available. Okay, so what do we have on the unit? Well, the nurse, it literally says, has heparin sodium 20,000 units per 250 mLs. Okay, so remember guys, getting the units per ml is just really getting that concentration. So it's really just as simple as dividing those numbers together and you're going to get that number. So 20,000 units divided by 250 mLs, you're going to see that it's 80 units per ml. Okay, so step number 2, you would calculate the mLs per hour. So you have your units per ml now. So you immediately put, of course, on the bottom there, units per ml concentration, you'd put 80 because that's what we just got. And then the dose per hour desired. So what does the doctor want? Okay, the doctor wants 1,200 units per hour. So it's already set up for you. So you do 1,200 divided by 80, and there you go. You get 15 mLs per hour. If that didn't make sense to you guys, please drop it in the comments. I'll help you out. But this is probably the most, I would say, the most difficult problem that nurses students get a hold of during their dosage calculation exam that I've seen when I've helped students out. They usually kind of get stumped on this because these are the kind of questions that have lots of different like additional information that really don't need. So try to, if you know your formulas really well, you'll do just fine. You just do lots and lots of repetition. Okay. So if you guys are joining in here, let's go ahead and do some practice questions together. And if you haven't already, make sure you guys go ahead and download the free study guide here that I am showing you right now. It's completely free on CoursettaNursing.com, so that way you guys can kind of test your own knowledge with that. But we'll go ahead and get started here. Let me go ahead. I'm actually going to go do an overhead of me actually doing the problem so we can do it together. Let me get to it real quick. Okay. Okay. Let me turn this on for you guys. All right, so you guys should be able to see it. Let me turn this back on. Maybe not. So we'll go ahead and do some problems together here that you guys are seeing. I'm trying to get this camera working now. Let me go ahead and just set this up here. Okay, there we go. So, all right. So let's go ahead and do some problems together for this dosage calculation exam. Hopefully it's kind of close enough. If not, just let me know if you guys can't see very well. But I have it referenced here on the screen. So let's do practice problem number 1. See what kind of problem it is. All right, so practice problem number 1 reads, a healthcare provider prescribes 2.5 milligrams of midazolam. If you haven't given that medication, that's a fun one. The medication vial contains midazolam with a concentration of 2 milligrams per ml. How many milliliters should the nurse prepare to administer the correct dose? So what kind of dosage formula should we be using for this? So we want to do the medication dosage. It's just simply asking, what dose should we give for this medication by volume. So it's asking how much midazolam should we give this patient based off the order. So what's the first question we always ask ourselves? And first of all, do we need to convert metrics? That's always the first step. So step number 1 here, we have the provider wants in milligrams, and you have milligrams, so we don't need to convert here. All right, so we're past that step number 1 already, so let's move on to the formula. So what formula do we need to use? Well, we need to use the medication dosage formula, which if you guys remember, it's D, which is what does the physician want? So it would be D over H. So what do we have times Q? What's the quantity of the dose? Equals A, which is your answer. I'm not sure how well you guys can actually see that. I apologize if it's pretty hard to see. I'm going to try to get close here. That way, okay, that looks a little better. All right, so let's go ahead and do this practice problem together. So once again, let's read it again. Let's fill out the number. Let's just identify the numbers. We know our formula, so let's identify the numbers. Let's forget all the other pointless things, because that's what they like to do on the dosage calc exam. They like to give you pointless information, so that way it's kind of confusing a little bit. So, okay, the healthcare provider prescribes 2.5 milligrams. So first question is always asking, okay, what does the physician want? I just want to know what the physician wants, right? So what does the physician want? Well, they want 2.5 milligrams. All right, so desired is 2.5. So we put that there. All right, and then what do we have on the unit? Okay, so H means what do we have? So let's go ahead and find that. So what do we have? Let's put milligrams there. So the medication vial contains minoxidil with a concentration of 2 milligrams per ml. So we have 2 milligrams per 1 ml. So the quantity would be 1, because that's 2 milligrams per 1 ml. And it's asking how many milliliters, so we are already in milliliters, so we don't need to convert, should the nurse prepare to administer the correct dose. So we have our formula set up. So go ahead and drop in the comments of what you guys think is the answer to this, and we can go ahead and put the answer in for you in a second. So if you have a guess of what the answer is, or maybe, I don't know if you guys have a calculator or not, but maybe you don't need one for this if you have the good math skills there. But I'll wait like maybe 10 seconds for you guys to answer it, and then I'll go ahead and keep going so that way you can save some time. So it's just simply, we found out what's the first question. First question is always like, okay, what does the physician want? Second question is, okay, what do we have? It's just try not to overcomplicate it. It's really just as that simple of doing your medication dosage formula here. And then the quantity is usually just your concentration. So it's like, in this example, it's 2 milligrams per 1 ml. So, okay, all right, so let's go ahead and answer it. So all it is 2.5 divided by 2 times 1, and you're going to get 1.25 mLs, right? Yeah, so 1.25 mLs. So if you got that, congratulations. So let's go ahead and move on to practice question number 2. So we'll go ahead and move this up so you guys can see it, hopefully. I know it's probably maybe not the easiest thing to see in the world, but you guys can also see it in color form there. But we're on practice question number 2. Back it up a little bit. So I'll read it out loud just in case, because it is a small text. So a healthcare provider's prescription reads ibuprofen 0.8 grams orally once daily. The medication label states that each tablet is 200 milligrams. The nurse prepares how many capsules to administer one dose. All right, so what's the first step of medication dosage formula? Is converting your metrics. So we have, so what does the physician want? That's my first question. What do they want? They want to give the patient 0.8 grams orally once daily. The medication label states, so what do we have, is 200 milligrams. Okay, so those aren't matching metrics, so we need to convert here. So step number 1 is converting. So what is the available dose? Let's go ahead and do our formula so that way we know what formula we're even using. So it's asking, how many capsules. So this is the volume formula that we talked about earlier. So your volume formula is D over H times Q equals A. What the heck does that mean if you're just joining? You probably haven't seen it if you're just now joining. D equals desired dose. Okay? So what does the physician want? H is what we have, so what do we actually have available on the unit? And then Q is just a quantity, so like your concentration of what we have. And then A, of course, equals answer. All right, so every time we have a volume-based kind of question like this, it's asking you whether it's, how many capsules do you want, how many milligrams, milliliters, those kind of questions. That's volume-based, so that's the formula you would use every time. So we have, what do we have? We have something in milligrams, so we have capsules that are 200, or tablets that are each 200 milligrams. Okay, and then we have, what does the physician want? Well, they want it in grams. So we're going to have to convert grams to milligrams because we have it in milligrams. So we need to convert it to something we actually have. So if you guys remember, we have a larger number to a smaller number. So you would move the decimal point 3 places to the left. So that would be your way of converting that. So 3 places to the left. So we have something here with, so we start with the larger number to a smaller number. So we would be, let's see here, just make sure, yeah. So it would be 0.8. I'm sorry, we would move 3 places to the right. I apologize. So we would move 3 places to the right because we're going from a larger to a smaller number. All right. So we go 1, 2, 3, and that would be 800 milligrams. Okay. So 0.8 grams equals 800 milligrams. All right. So you already converted. So let's go ahead and fill out the formula. So what's the desired dose? Well, the desired dose went from 0.8 grams to 800 milligrams. So that's what we would put for D. So let's go ahead and put our formula here so we can separate it out here. So hopefully you guys can see that. So D is 800 milligrams instead of the 0.8 grams now because we converted it. So 800 milligrams divided by what do we have? Well, we have something 200 milligrams per tablet. 200 milligrams per how many tablets is 1, so we just do the quantity times 1 equals your answer. So if you guys divide that out, it would just be simply as 800 divided by 2 or divided by 200, and that would be your answer of 4 capsules. So that would be your answer there. So let's go ahead and do a IV infusion one. So let me go ahead and skip to that. Let's see what we have here. Oh, let's do a drops per minute one. I think that's what, a lot of, we'll do a drops per minute one and then we'll do a units per hour one to give you an example of that. And once again, guys, if you're just now joining in, go ahead and you guys can go to CorsetaNursing.com. I put it in the chat there. And you guys can download this worksheet for free, so that way you guys can get some practice with these. But this is just, I'm showing you exactly what you can have from that website there you can download for free. So let's go ahead and do number 3 here. So number 3, it's right, I'll make it parallel there so it's easier. So number 3 reads, a healthcare provider's prescription reads 2,000 mLs of normal saline to infuse over 12 hours. The drop factor is 15 drops per 1 ml. Remember, guys, earlier we mentioned that if there is something that mentions a drop factor, then we're reusing our drops per minute formula. The nurse prepares to set the flow rate at how many drops per minute. So there we go. So it gave us a drop factor, so we know right away that this is a drops per minute question. So let's go ahead and do a practice problem. We'll do this practice problem together. All right, so what's the formula for drops per minute? Well, there's 2 different things that we need to put in there. So first question is the total volume in mLs. So what's the total volume in mLs divided by, and then next would be the number of minutes. So whatever minutes it gives you. So we'll put number of minutes times what? Your drop factor. So anytime there's a drop factor, you know you're using the drops per minute formula. So this is your drop factor. And all your questions will literally say a drop factor of blank with the number. All right, so that would be your formula that you need to use. All right, so let's go ahead and plug and play these numbers. So once you know your formula, guys, don't even pay attention to anything else. You might as well just, the scenario doesn't even matter in the dosage calculation exam. So that's the great thing about dosage calc. So you can really just be hyper-focused on a certain thing. If they give you like a good, long scenario, that it could really confuse you if you try to pay attention to that. So if you just know your formulas and you're just looking for the numbers, that's the best way to do it, really. All right, so where's the total volume in mLs? So the prescription reads 2,000 mLs of normal saline. So there's your total volume. So there's not much room right here, but I'm going to put it right 2,000 mLs divided by the number of minutes to infuse over 12 hours. All right, so we need to convert that to minutes. So of course, 12 hours times 60 minutes, because there's 60 minutes in an hour, you would equal, and I mean, I'm not going to calculate and spend your time, but it's 720 minutes. Okay. And then times your drop factor. So where's the drop factor? It is 15 drops per 1 ml. So there you go with the 15. So there you go. We plugged our numbers in, and you would just multiply it. So first divide, of course, and then multiply. So 2,000 divided by 720. And then you're going to get 2.777 times 15. And then once again, guys, remember if you're still here from earlier on, you never want to round your number until it's the final answer, because that will mess up your final answer. So you just put in 2.777 times 15, because that's your drop factor, and you're going to get 41.666. And then that's where you round your final answer. And drops per minute's always rounded to a whole number. So you're going to round up, and then you're going to get 42 drops per minute. So this is 42 GTT per minute. And always, guys, put in the actual metric there at the end. Don't ever just leave it blank, because of course they're going to count that wrong. And of course you want to show your work like this too. All right. So let's go to the last one. We'll go do a units per hour, and then we can call it a day for a dosage calculation. So let's go ahead and do number 4 together. So this is probably what nursing students struggle with the most, is the units per, either the drop factor or the units per hour conversions. So let's go ahead and do this one together. So it reads, a healthcare provider prescribes heparin sodium 900 units per hour by continuous intravenous, so IV infusion. The nurse has heparin sodium 20,000 units per 250 mLs. What rate in the mLs per hour should the nurse set the infusion pump to deliver 900 units per hour? So here we go. These questions are pretty long typically, and really there's 2 steps with this too. So you need to know your formulas, and if you know your formulas really well, and by the way you can do that is just by lots and lots of repetition. If you know your formulas really well, you'll do just fine. All right, so what's the first formula? If you guys remember earlier on, the first formula is the total amount of units in the solution divided by the total volume of that solution. Because why? We want to get the concentration of the volume that we have. So we would do units per ml, for example. So we want to find units per ml. All right, so let's go ahead and do that. So the total volume, let's go ahead and write it out. Total volume divided by the total amount of units divided by the volume. I did that backwards. Total units divided by the volume, total volume, equals your units per ml. Okay, so where's our units? So what do we even have? So really how we figure this out is by finding what we have. All right, so we have heparin sodium 20,000 units per 250 ml. So you would literally just divide those, because right there's your total amount of units in the bag divided by the total amount of volume, which is exactly what our formula wants. So we would just divide those out. So it would be 20,000 divided by 250, and you would get your answer. And that answer is, real quickly, is, let me find it, 80 units per ml. Okay, so there's that. That's step number 1. And then step number 2 would be do your dose per hour desired divided by your units per ml concentration. All right, so let's put the dose per hour. So we got our units per ml, which is what we need for the next range, for the next formula. So we have the dose per hour desired. So dose per hour desired divided by the actual units per ml concentration that we just found, so 80. Okay, so what is the dose per hour desired? All right, the dose per hour desired is 900 units per hour. Okay, so this would be 900 divided by 80, and then there you go, you got your answer. It would be 11.25 mLs per hour. But if you, of course, this is you want to round up or down, so this would be 0.4 lower, so you would run a round down in this case, so it would be 11 mLs per hour. Okay? All right, guys. So that goes over most of the problems. Now, we didn't do IV, such as mLs per hour, but those are kind of self-explanatory, especially with the problem. So let me go ahead and shut these off here. But we didn't go do any IV, like mLs per hour or the infusion duration, for example, because those are pretty self-explanatory. So we took the time to kind of show you guys the more difficult ones, such as like the drop factors and the units per ml conversions and all that good stuff. So once again, guys, if you wanted to watch this entire video, you're just now joining in, I will be posting this on our YouTube, so it's Coursetta Nursing. So you guys can find us on YouTube. We have lots and lots of other videos as well, not just dosage calculation. This is actually our first time doing a dosage calculation live course. But we're going to put this up on YouTube. So we have lots and lots of other courses, such as fluid and electrolytes course, EKG rhythm interpretation, all that good stuff. And then the form you're looking at right now, where I'm showing you here, is completely free on CoursettaNursing.com. You guys can find it and download it for free, such as also ABG worksheet for free, cranial nerve worksheet, EKG interpretation worksheet, fluid and electrolytes worksheets completely free on there as well. So you guys can find all kinds of forms on there on the website. I put it in the chat there. It's CoursettaNursing.com. And if you guys wanted to watch this full course and you're just now joining in, go ahead and go to our YouTube and you'll find it up there uploaded by tomorrow morning as well. And we do also have another dosage calculation course already there that's pre-recorded, of course. It wasn't a live like this. But thank you guys for taking the time. So whoever joined, thank you so much for taking the time to watch this live course, and I will see you guys in the next one. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.